Country appeared to be on a lull with reduced number of infections and the need for hospitalization. But the last few days have seen an upsurge both in terms of new infections as well as severe cases that end up in hospital. While many public facilities are stretched to the limit, but now even private hospitals are recording a significant spike in new admissions and demand for oxygen. That's right. Now, Citizen Television got access to the Nairobi Hospital's COVID-19 unit at the height of the third wave, and as they race to save lives. Here now is that special report, Oxygen Frontline, with our very own Victoria Rubadiri. Now, more than ever, the ability to breathe on your own is a gift. For the over 1,400 patients currently admitted with COVID-19 in various health facilities, breathing comes at a hefty price. They are literally inhaling hundreds of shillings with every breath to beat this invisible enemy.
If you ask me, of all the medications that we use to treat COVID, oxygen is number one.
Now, it's become abundantly clear that oxygen is the main therapy when it comes to COVID-19 treatment. So a hospital without enough oxygen is fighting a losing battle. Now, take this into consideration. A critical care COVID-19 patient consumes 15 liters of pure oxygen every single minute. Now, when you take that into account over the course of 24 hours, that comes to 21,600 liters. Now, take a look at this oxygen cylinder right next to me. Its capacity is 8,500 liters, meaning that a COVID-19 patient in an ICU ward would go through 2.5 of them in a day.
The exact cost of such consumption can vary, and few hospitals are willing to share figures. However, at the height of the third wave in March this year, a leading industrial gas company would retail oxygen storage tanks holding 20,000 liters for as much as 15 million shillings. The costs would, however, vary for oxygen refills. It is a costly affair, and one that even at the government level began to show. On March 29th this year, Health Cabinet Secretary Mutahi Kagwe sounded the alarm on the oxygen shortage.
We are appealing to anybody who is holding oxygen cylinders to immediately return them so that the companies can be able to use them to supply oxygen to our hospitals. They are a matter of life and death.
By that time, the country's oxygen demand had more than doubled from 410 tons early last year to 880 tons. It is hard to believe that a year into the pandemic, public health facilities in Kenya had only 16% of the gas they needed to fight COVID-19. This is Nairobi Hospital's oxygen plant. Until recently, it lay dormant. The pandemic, ironically, is what breathed new life into it. Arnold, who mans the hospital's entire oxygen capacity, says pre-COVID-19, the whole institution's consumption was 5,000 liters in 24 hours. At the peak of the third wave, that shot up to
1.5 million liters.
And what happens out here is just as important as what happens in here. This is the red zone, or the intensive care unit ward for critical COVID-19 patients. Less than a year ago, this facility was not here. In a matter of months, however, the East Wing was built specifically to treat COVID-19 patients.
Our oldest patient was 103 years of age. Luckily, he survived the COVID and was able to go home, probably because he did not have lots of comorbidities. Our youngest patient is a 6-month-old baby, also has done extremely well.
While filming, we were alerted a new patient had just arrived. Admissions to Nairobi Hospital's East Wing have been picking up again in recent days as the country braces for a potential fourth wave. After our first day of filming, we were informed 30 new patients were admitted that very night. During the third wave, Dr. Okioma says this was the daily occurrence here.
The peak of that wave, we were admitting as many as 20 patients in a day.
And the treatment methods are evolving. Whilst face masks have been used since the start of the pandemic, helmet-based ventilation has proven to be superior for patients with ventilatory distress.
It is better tolerated than the mask. And I say that because the patient is in a hood, they are able to turn their necks, they are able to speak, and more importantly, they are able to drink or even eat what you call puri food.
This facility hosts patients from all over the country, the region, and the continent.
We had lots of patients from Malawi, Madagascar, the Comoros. We got a few patients from Zambia and Mozambique as well. And to our east, we had lots of patients from South Sudan. We had patients from Somalia, Ethiopia, all the way to Djibouti, and as far as West Africa and Gabon, Central African Republic.
Maggie manages the East Wing. With over 25 years under her belt as a nurse, her experience was necessary, especially during the third wave.
It was a very difficult time because people were calling and hospitals were calling in need of the critical care beds, and we did not have them because at that point we went at a full capacity of 135.
It's a beehive of activity catering to critical care patients, all with unique health needs. And working in a COVID-19 critical care ward comes with its challenges for the staff who tend to patients. Reverend Murungi has been offering spiritual support at Nairobi Hospital for 6 years now and admits this has been the most challenging season for the institution yet.
But we got to a point during the third wave when we are not in charge, and it was very overwhelming. We got to a crippling point of fear. And now the work for the chaplain and the psychosocial counselors was a lot. When you get into the COVID, before you even get to see the patients, the staff are overwhelmed.
She sees her work as being a supplier of spiritual oxygen.
It was an international guest and they asked me, I think I am very encouraged because why would you risk your life? You're not coming to give us an injection. It's not like, spiritual care for them is not a do or die. It's not medicine. So they are wondering why you would risk your life to come in just to pray. That one becomes a message for them. That one stirs hope.
Over 2,000 patients have been treated here since the institution was opened in November last year.
So most of the patients who are coming here, actually we are having 90% surviving.
George Okungu is one of the 90%. He was in ICU for close to 40 days.
To be on a ventilator, it took time, and it was a scenario that was totally unexpected from me.
Unexpected because, incidentally, Okungu was admitted into Nairobi Hospital's HDU just days after receiving his second AstraZeneca dose.
So the jab gets effective after something like 14 days. So what happened when I got the second vaccination, I got this ailment 6 days after the second jab, which means the 14-day period had not elapsed. And then I think they also said I must have had it maybe sometime before the second jab. So it is a gray area. It's a completely gray medical area.
What is not a gray area, though, is the clear and present danger that lurks with an impending fourth wave. And more worrying, Dr. Okuyoma says, is a younger demographic that's now showing up in their wards.
This